So the first question that I wanted to ask you was, please can I ask you to kind of very briefly introduce yourself, your past experiences in the space, and also your work on macrophages?
Okay, so my name is Nir Ben Chetrit. I'm going to open a lab soon in Cornell. The lab will be studying a few elements that relates to macrophage biology and solid tumors. First, their localization in the microenvironment, how this localization and cellular interaction shape their phenotype. This is one avenue we just more exploratory, just to understand the phenotype. And the other arm is more sort of in the intervention approach. So we try to intervene with their tumor supportive phenotype and use macrophages as a tool for therapeutic intervention in cancer patients. And we are envision a scenario we can take macrophages or monocytes, re-engineer them ex vivo, and then transfer them back to the patient to deliver a very strong immune responses that basically starts with the innate, but later on propagate into adaptive immunity. So that's sort of the scope of the lab. So we use several methodologies, a lot of spatial tools, genetic, proteomic, and in the intervention we use mainly CRISPR to try to search for genes and pathway that can make the macrophages adopt the phenotype we are interested. So that's basically what is the lab about. I did a short postdoc in Joanna Joyce lab. That's where the macrophage angle started. I joined the Weill Cornel Dan Landau's lab and basically developed all the approach of therapeutic intervention in macrophages. The screen in TME macrophages was done here. And then this will be continued to my lab. So basically that's sort of summarizing where I'm positioned in the field.
Okay, thank you very much. And then my next question is sort of about the space more generally. So I know that this space had some kind of initial setbacks over the past year with CD47. Sorry, yeah, CD47. Yes. So I just wanted to ask you, how do you feel the community has pushed through some of these challenges? And what are the biggest challenges that the field is currently facing?
Yeah, so the story in the macrophage and tumor progression is a very old story. And this has been recognized, I think, like 40 years ago, first by Montevani. He basically first coined the term tumor-associated macrophages and the impact they have on the tumor progression. And this is basically harnessing something intrinsic macrophages have, which is the ability to repair a wound. And that's what actually happened in the tumor. However, modulating their phenotype is extremely difficult. And this is one of the major problems and the challenges we have in the field. First of all, macrophages they're not using one modality, they use multiple modalities. So they can influence the tumor microenvironment in many, many ways. And that's also, in one end, this is very good because if we manage to manipulate them, we bring all of them together. However, the current approach is trying to tackle one out of the many. And that's, I think, the main reason for this kind of lack of success so far, because yes, you can utilize one, but you still have the others fully functional. So we are missing like the jackpot that we basically experience with the PD-1 in the T cell space, right? So we still try to find like those targets that will flip entirely altogether the phenotype. And so, as I said, like this is a well-recognized target. Primarily, the pharma companies try to deplete their numbers just by CSF1R, and this did not generate a meaningful results in the clinic. Because targeting the numbers is not the way. And if we try to think about the analogy with T cells, so it's like infusing more T cells in the TME, this did not move the needle. But really move the needle is actually altering the phenotype, right? And that's basically where the field is today, try to understand how to flip the macrophage or how to harness macrophage plasticity and to make it like therapeutic intervention in cancer patients. So the setback is basically because the macrophage are very hard to manipulate.
Yeah. Yeah, I've
Challenging,
definitely
but
heard
still,
that before in my research. Yeah. And my next question is, where do you see the macrophage-directed therapies space in, say, 5 years' time? What do you think the future is going to look like?
Yeah, I'm biased, right? Of course, I'm coming from the field, but without any doubt, the macrophage reprogramming, once we can actually modify the phenotype in vivo or in patients, this will be like the next, I would say, the next PD-1, the equivalent to PD-1, because once you, and there are several success in the field, so there are several hits that already demonstrate that if we can manipulate their phenotype, the tumor starts to regress. So the adaptive will follow. So I think, without any doubt, this is the next therapeutic, I would say, blockbuster.
Yeah, that makes sense. Thank you so much for that. That's very interesting. And then the next question that I have is kind of more specifically around the 6th Macrophage-Directed Therapies Summit. So I'd love to hear sort of how these kinds of conferences help to advance this community and bring people together.
Yeah, I think like the most important is to bring two different, I would say, realms together: the academic and the industry. Each one of these, edges has its own advantage and disadvantages. The academic side, we are on the front of discovering new therapeutic, let's say, targets, but we lack the scale and the manpower you can have on the industry. So I think like bringing these two together into one platform that we can, in a span of like 3 days, exchange information and start collaborating. And this would be really interesting and very, I would say, very helpful to facilitate the macrophage field into, the next level.
Yeah. Thank you so much, Nir. That's actually my last question for you, but thanks so much for answering my questions today. And yes, looking forward to seeing you at the event. Thank you.
Thank you. Bye-bye.
Bye.